Hey everyone, Kevin Henry, the editor-in-chief for drbycuspid.com. Thank you so much for joining us for today's episode. Super excited to be talking today to Dr. Anjali Rajpal, who's a cosmetic dentist and the CEO of Beverly Hills Dental Arts in Beverly Hills, California. Dr. Rajpal, how are you today?
I'm great. How are you?
I am great. Thanks so much for being on today. Before we dive into our topic, would you mind just telling our audience a little bit about yourself?
Sure. So yes, I'm a cosmetic dentist here in Beverly Hills. The name of my practice is Beverly Hills Dental Arts. I've been practicing in the area for years, but I finally opened my very own office about 5 years ago.
Congratulations on that. And I know, just judging from your website, obviously a lot of folks come to see you and a lot of folks are very happy with how you make their smiles look. So what is your philosophy on making your practice stand out in Beverly Hills? I'm sure it's a crowded space. How do you stand out?
I think it's really kind of the vibe that we create here. We've created a very relaxed, comforting, soothing environment where even the most anxious, fearful patients that come in, they'll just end up sinking into our chair and just becoming one with the relaxed environment that we create. So I feel like we've just kind of changed the way that dentistry feels for a lot of people and just eliminated some of the roadblocks that they might have from their traumatic past or whatever it is that's causing this fear. So we're just trying to create a different experience in terms of what dentistry can be like. And we just want everybody to walk out with a smile. So we're trying to create very natural looking smiles for them so that they are comfortable as they walk out and show off their smile to everybody.
So let's talk a little bit about maybe your philosophies of smile design. How do you make sure that patient does walk out happy and with the smile that he or she wants?
We're just very honest with our communication, and we really try to understand whatever our patients' needs are so that we deliver whatever will actually enhance their smile and enhance their mood and just make them emotionally feel better about what their smile feels like when they're actually smiling. So yeah, I think the key is just to understand what kind of style of smile they would feel comfortable with and just show them with images how an explanation of how basically we are very conservative minded in terms of removing tooth structure. We follow a very biomimetic type approach because my patient population is generally very young, but even for the older patients, I just don't like to be aggressive in the way that I work. I try to preserve as much natural tooth structure as I can, and I try to make sure that I place the teeth in the best position through Invisalign or whatever I need to do so that the forces are balanced and so that they actually last really well for the long term. So I think it's just kind of a conservative mindset in a way, but at the same time achieving dramatic results at the end so that it's a complete transformation, which is beautiful and enhances the way that they feel and look about themselves, but is also not obvious and fake looking where they feel awkward with their smile. Like we really just want it to flow with our patients' faces and have them be more confident in the end.
Do you feel like your philosophy of conservative tooth design matches that younger generation and maybe puts them at ease knowing that you have their original smile, shall we say, in mind whenever you start your work?
Yeah, I kind of find it funny because it seems like a lot of people just would naturally want veneers because that's such a trend that's been going around. But so many of these young patients come to me and the first thing they tell me is, I don't want veneers. And it's just because they see so many fake looking ones and just ones like videos of tooth structure getting ground down so aggressively. So I think everything that they're seeing on a regular basis, yes, they are veneers or crowns that are done, but that's not the look that they're going for. And they obviously don't want to be, they want to save their tooth structure too. So I think a lot of the younger patients that I'm seeing are naturally asking me to also, like, what is the most conservative approach for them. So if I don't like pushing work unless I actually think it's beneficial for them. So if I see that their teeth are generally great proportions, great colors, there's just very little that needs to be changed, then sometimes it's just teeth whitening and a touch of bonding and maybe Invisalign that they need. But if we do want to change up the whole look on a patient, then yes, we'll jump to veneers. It just is such a case by case basis. But I will communicate with them and show them what their options are so that they can make the best informed choice for themselves and they can decide what's best for them for the long term as well.
Do you often find patients coming in with an idea from social media or the Hollywood smile, shall we say, and then you having to communicate really what's best for them rather than maybe what they have in their head is what's best for them?
Yeah, so that's why again I show them all the options that we have in cosmetic dentistry because obviously dentistry has come such a long way. I mean, I'm not placing silver fillings anymore, and where the porcelain has become so much stronger through the years that we don't need a ton of porcelain or a metal base for strength. Now we have such densely, highly concentrated porcelain that's so strong on its own and the bonding technology is so amazing now too, that we don't need to be cutting down, we don't need to be doing crowns all the time if we have the option to do inlays or veneers. So because of the great bonding technology, we can actually provide a variety of options to our patients, and they can understand how everything works and make the best choice for themselves.
You mentioned whitening a few minutes ago, and I know that whitening has advanced so much through the years. How has that helped you as a cosmetic dentist be able to offer the different options to your patients?
Well, our culture is all about coffee drinking and wine drinking and hope. In California, really, people are not smoking that much, thank God. But all of that staining just becomes ingrained in our patients' teeth over their time. It just naturally, if you're drinking coffee once or more every day, that color is going to sit inside your tooth structure. So teeth whitening is really the best way to actually enter the pores and pull out the discoloration from deep within. So yeah, it's our in-office whitening just takes about an hour, and we see with our patients that it'll end up jumping a couple shades. And so then they just want to keep maintaining that because it just brightens up their entire face and makes such a difference.
How do you position that in your practice? Is it usually as an add-on, or is it as something that is a standalone? Which do you see more of in your practice?
Both. We do a lot of standalone, and then whenever I'm doing a veneer case, I'll always, or even bonding, I'll always make them do teeth whitening in addition, because that way we can pick a shade for the veneers or the bonding that's whiter than what they have right now, and then maintain that whiter shade. So yeah, I always like doing it in combination with any cosmetic restorations that we're using as well.
You mentioned the communication about cosmetic dentistry in your practice. How does your team play a role in that communication as well?
They are trained to be very loving and understanding. And I think whatever I do ends up trickling down. Whenever you are a boss or a parent, you have to lead by example. So I think naturally the staff just kind of gets into the groove of however you are acting and behaving, and they mimic that. So yeah, as a leader in anything, I think it's really important to lead by example and just basically show how and discuss how important it is to communicate with the patients. They're all trained a bit at the beginning, but I see them all naturally just improve over time and really learn to bond with the patients. We have a great patient population. It's really fun having conversations with a lot of our patients. So they are enjoying that bond as well and that rapport and yeah, it's nice to be a dentist where we actually have the opportunity to see our patients on a recurring basis and just further deepen that bond.
In perusing your website, you use before and after photos, you use video testimonials. How important are things like that for patients to see before they come in and understand really what you can do and how you've changed other people's smiles?
I think it's super important to see how the different options work between bonding, veneers, inlays, teeth whitening, and just so people can understand exactly what the transformation involves. Because like I said, images are so important. I can explain things as best I can, but dental talk is not always easily understandable. With an image, it just makes it so much easier, so much more easily understood. And yeah, and then just by seeing how patients are feeling themselves having been here, it definitely adds a sense of comfort because they kind of understand what they're getting themselves into. So a lot of people, I feel like they kind of already know me before they get here because they've been able to see me online in whatever capacity, and they kind of already have a feeling of what to expect when they get here.
And last question for you. Being in Beverly Hills, I'm curious, what trends are you seeing in cosmetic dentistry right now? And maybe what are you looking for the rest of the year?
So I can't really tell exactly what's happening with just facial transformations and everything, because obviously my building and this area is full of plastic surgeons. So many people are going for such a similar look, but then I feel like the future generations may be pulling away from that a little bit. It's a little tricky. I can't figure out exactly what's happening yet, but I'm hoping that people shift back to using plastic surgery and using cosmetic dentistry to enhance however they look, but not go to such an extreme where they've lost their original character, because we're created by nature, by God, with our features in their own unique way, and our personality shows through that. And I feel like if you go too extreme, then you end up losing your own natural characterization. So I like to keep a certain amount of my patient's natural look, because nature always designs things in its own amazing way for a reason. And so the way that we're designing veneers and bonding, we're really trying to emulate nature, because that's what looks right on a face. When you go too extreme, it just disrupts the flow, and you I feel like you can't even really fully connect when something looks too extremely artificial on someone's face.
Understand?
So yeah, I'm hoping Gen Z, and as things transform, they actually honor their own natural beauty more, and maybe just use these advances to make subtle corrections, but not change themselves up so much, and just kind of appreciate their own natural beauty more, so that they don't feel the pressure to do that.
I think that's a great thought and a great way for us to end today. Dr. Rajpal's website is www.bhdentalarts.com, and you can learn more about her there, as well as see the before and afters and video testimonials, as I mentioned. Dr. Rajpal, thank you so much for your time. I know you're very
Of
busy,
course.
and I truly appreciate it.
Of course, great talking to you.
Yeah, and to you as well. And thanks to all of you who've listened to this episode of the DrBicuspid.com podcast. Hope you've learned something today, and we appreciate your time. And until next time, it's Kevin Henry, Editor-in-Chief, signing off. And as always, wishing you nothing but success ahead.